This week, the FDA approved a new drug for Alzheimer's, a groundbreaking advancement to slow the progression of this disease. Here to explain more on what this means for patients is Dr. Peter Glebas with Baptist Health. Dr. Glebas, thank you so much for being here with us this morning. Let's talk about what this new drug means for people who currently have Alzheimer's.
Sure. Good morning, Natalie. This new medication, donanemab, is delivered through infusions once monthly. What it is, it consists of the antibodies that, when infused, they reach the brain and attach to abnormal protein amyloid that accumulates during the disease process. By doing so, this gives a signal for the body to clear it. And the studies show that actually it does this job very effectively. Now, by clearing it, what it does for the patients, it was shown that it slows down the disease progression. So that's what we call disease modification, disease-modifying therapy, because it actually changes the trajectory of the disease.
And Dr. Glebas, what stage of Alzheimer's will this drug, work for? What kind of patients? Where do they have to be on that path?
So this medication was trialed and approved only for the mild stages, the beginning stages of the disease. The stages, what we call mild cognitive impairment and mild dementia. Mild cognitive impairment means that the person already has objective cognitive problems. We can measure them, but they're still functioning independently. Or mild dementia stage, when the person, because of the cognitive problems, already starts needing some help with their independence. Again, approval is only for the early initial stages of the disease.
So anyone that is watching right now, that say, hey, maybe this drug could work for me, what are some of, I guess, the symptoms that they would be experiencing now?
So that would be, the most frequent symptom would be forgetfulness. But forgetfulness is something where the short-term memory problems, unable to recall what they did yesterday or on a day-to-day basis. Some people with Alzheimer's disease, they can also present with the language problems or difficulty with the navigating, but most frequent would be forgetfulness.
What are some of the side effects of this drug?
There are several side effects that are worth mentioning. One, it is, as I mentioned, infusion medication. So any time when infusion medication is delivered, the people might develop what we call these infusion-related reactions. And that can vary from very mild, headache or gastrointestinal abnormalities to fairly severe respiratory or cardiovascular problems. That's why this medication needs to be delivered in the infusion unit under the supervision. Now, another more specific side effect of this medication stems from the mechanism of action, because these antibodies attached to that abnormal protein in the brain, it can actually, that reaction can cause swelling or even small bleeds in the brain. So that's why we do have protocols how to monitor the effectiveness of this medication and possible development of the side effects.
Dr. Glebas, this is the second drug to receive FDA approval in about a year. There was one approved last year. Does this mean that we are just one step closer maybe to finding a cure?
Oh, I hope so. We're definitely moving the right direction. We're definitely moving the right direction. We're already changing the disease trajectory. We're modifying the disease. And this will accelerate, further research and bringing new medications, working through this mechanism and working through other different mechanisms. Can I say that the cure is around the corner? I cannot, but we're moving the right direction.
All right, bringing hope to a lot of people and families. Dr. Peter Glebas with Baptist Health, thank you so much for being here with us this morning. If you want more information, you can head to our website, WPBF.com.